Hi, everybody. I'm DJ Sixsmith. Welcome to Sit Down. Dr. Caesar Djavaherian here with us. He's the co-founder of Carbon Health. Carbon Health now really an important player in the COVID-19 vaccine distribution in Los Angeles and eventually around the country. Doctor, really nice to meet you. How are you?
Yeah, thanks so much for having me.
So as we both know, the vaccine distribution has been a little messy, a little bit uneasy at times, whether it's people trying to get their appointments, the number of vaccines in general, people trying to get multiple doses. It's been pretty crazy. So Carbon Health is here to help when it comes to the technological side, and especially in Los Angeles. How did you and your group get involved in LA? Why don't we start there?
Yeah, so our efforts in LA were kind of came about when we partnered with the city's fire department and a nonprofit called Core Response. Basically, LA realized that some of the technologies that they had incorporated for vaccine distribution started to not function as efficiently as they were hoping. And we had anticipated, Carbon Health, we'd anticipated that vaccine distribution, the logistics side, the technology side, the operations were going to be much more difficult to kind of execute on than most cities and counties had anticipated. So we built a product around exactly that, which is, from the moment of, from the point of scheduling to the point of the second vaccination, what needs to happen to make the patient experience wonderful, to create transparency to the community about the number of people who've been vaccinated. So we built technology around that. And so when the fire department and Core Response came to us with this opportunity, we were ready to launch. So we actually launched that program 31 hours after our initial meeting with the city, which is incredible.
Yeah, I mean, listen, that's really great to hear. And it's awesome that your group is stepping up. And, from what I read, the wait times were 2 hours. It's down to under 10 minutes. But at the same time, you have people out there who are like, why can't I sign up? And I know there were some tweets out there saying like, we don't have enough vaccines. So can you just clarify right now what's going on with scheduling and just where we're at in the whole process?
Yeah, thanks so much for asking that question. So the one thing that we don't control at Carbon Health is the vaccine supply. And we work hand in hand with city and county officials to determine the number of vaccines that they will allocate to the carbon distribution sites. And so what's happening today is that even though the technology works perfectly well, that the on-the-ground operations have been incredibly smooth, the number of vaccines that have been allocated to the site has diminished. And so we can no longer fulfill new appointments, although we are in an automated fashion getting people their follow-up or second dose appointments for vaccines. So as that vaccine supply increases, we're hoping that happens over the next couple of weeks, we'll be able to then meet the demand that's waiting for us. So we've had 200,000 people sign up for vaccinations in LA, and many of those people are on the waiting list. We've administered 80,000 vaccines in just over a week. So as soon as we have those supply, we'll be able to efficiently administer those vaccines.
And another challenge here is that initially it was just essential workers who were getting the vaccines. Now it's based on age, and I'm sure that creates some more wrinkles in this whole process. So how has that changed the game for you? And more importantly, how do you think that changes things for Los Angeles? Because that brings more people into the equation here.
Well, that's actually one area where we really shine. So as the criteria change, and it could be a tweet from the governor, it could be the local public health officials who realize that they have extra vaccine. As those criteria change, our technology very easily can inform people when their time is up, like when they're now eligible to get the vaccination. So as soon as the age criteria was lowered to 65 for California, our team had already adjusted its algorithms to then inform people that they could sign up. It's one area where I think it really highlights the importance of having these partnerships where private companies like Carbon Health are working hand in hand with city officials, county officials, again, to inform people that it's their turn for the vaccine, and then to smoothly bring them into the process and get vaccinated. End to end, from registration to vaccination, we're generally talking about less than a 10-minute time for a patient, which is incredible when you read about what's going on in the rest of the country. And it's scalable. So we're more than ready to go into other communities and deploy our technology and help those communities who have supply and demand waiting, but just having a hard time with operation and logistics and technology.
Yeah, I think it's really exciting what you and your group could potentially do across the country. And like you said, collaboration is huge. I think communication is also really important too, because there are people out here that are reading these stories that there's extra doses of vaccines, or they can't get an appointment. And excuse my ignorance, but just for clarification, say I'm in the LA area, I don't have an appointment, and I'm trying to go to Dodger Stadium and hoping that there's additional vaccines there. Is that just not even a possibility? Can you just clarify that for everybody?
Yeah, so the real answer to that is that there generally isn't a good chance of getting it, though some people have been fortunate. And again, it's the end of the vial. There's no more, there are no more patients coming up, and they happen to be there. Our providers are not going to throw out vaccine. They're going to look for people to vaccinate for sure. I would say the odds are low, though, for people who are lining up, and I have seen images of people who are just waiting to get lucky and get called. That shouldn't be the standard for most people. Like, you shouldn't have to go and sit and wait for a vaccine like you would for concert tickets, right? We should have a much more efficient system where, again, through our technology, you get a text notification like, hey, if you're in the area, come in and get the vaccine. That, if we had a broader public health kind of response to this that was much better coordinated, I think that's the experience that you would have had in LA.
Yeah, I think coordination is really important. And then the other wrinkle here is that there have been a lot of folks that have gotten the first dose of it that still need to get the second dose, and then they're not sure if they can get onto the website. And I know that you and the group recently clarified, yes, you're in the system, you will get your second dose. So can you just expand upon people getting their second dose of the vaccine versus the people who haven't gotten the vaccine yet? How does that break down?
Yeah, and that's a great question. The second dose is really dictated by the public health officials. So the public health officials generally reserve a second dose for those people who've gotten the first dose, and then it's up to us to then inform them when their second dose is available. So having said that, when people are trying to get in to manually schedule that second dose, and they're getting frustrated by it, it's on the back end, our technology already is aware of them, knows that they need the second dose, and will inform them again when the public health officials make the vaccines available to us. So it should be a smooth process. An additional component is that generally you get the second dose 3 to 4 weeks after your first dose. Now the CDC has come out and said, it's okay to get that second dose up to 6 weeks later, providing some additional time for those patients to get in with the second dose.
Doctor, this is really a day-by-day thing, week by week. I mean, we're just hearing about the Johnson & Johnson vaccine, and even like we're talking about here with the scale of the operation, we need it to be more efficient. So when you think about expanding this from Los Angeles to the rest of the country, how realistic is it to make this into a timely situation where multiple states can benefit from your technology? Because you and your group have been building this, and in my opinion, it's probably further along than a lot of cities and states have. So how do you make sure that you get into those states where people really need this help the most?
Look, we are ready, willing, able to scale anywhere in the country that needs help. So some of the ways that we've impacted vaccine distribution administration is that, with the same number of employees, we've nearly doubled the number of vaccines delivered at the same site. So that shows you how important the technology is. In places where the scheduling process, the insurance process, the logistics, the operations, and then the vaccine administration have been a problem, we've solved for all those issues. We've made things like recording the visit and automated. So we're not spending time handwriting the vaccine and the lot number, which is what most people are experiencing. So we're ready and able to scale. And if anyone is listening to this and is interested in getting their community working with us, please let us know. Please reach out to us. We want to do this because it's a literal race against this virus. the sooner people get vaccinated, the fewer transmissions we have. I'm sorry, the fewer sick people we have, and thereby the fewer people who get exposed, and the less chance novel viruses, the mutations that are coming forth, will have a chance to spread in this country. So we see this as a race against the virus, and it's why we're so willing to work with other communities.
Yeah, I mean, there's so many different obstacles and challenges here. What would you say are the biggest right now? Is it the vaccine distribution? Is it people questioning whether or not they even want to get the vaccine? Is it the technological barrier for some of these older folks? What, in your opinion, has been the biggest hurdle so far for you and your group?
It's all of the above, unfortunately, and it depends community by community. So obviously, vaccine supply has been a tremendous issue. I think the other, kind of taking a step back and looking about how the vaccine distribution plan was hatched, was that pharmacies were going to have to continue to be pharmacies, but then vaccinate a large number of people in their communities. Unfortunately, that's flawed because you need a larger space than a pharmacy, especially one that's still functioning as one. So you need a place to observe your patients to make sure they don't have a life-threatening allergic reaction. So that means that you need seating for those people after they're vaccinated. So one was a logistical problem. Two was clearly a planning issue where people didn't necessarily imagine how the distribution process would be flawed in small areas. And then the solution to that is really having these mass vaccine sites like Dodger Stadium or other stadiums around the country, or other large parking lots even, where we can efficiently get people in, vaccinated, observed, and then out, and then have all of the kind of administrative stuff done through the technology so that there aren't long wait times and paper that needs to be filled out. So long answer to your question, but I think an important one.
No, I appreciate the full context there. And lastly, doctor, when you think about just the past year, whether it's telehealth or the changes we've all made in our own lives, so much has transformed. So when it comes to you and what you do, what are you most proud of in terms of the impact that you and your group have made, and even just the ability to adjust and adapt and help out in such a precarious moment right now?
I mean, every day our company, so engineers, operations team, marketing team, recruiting team, the physicians, nurse practitioners, and PAs, we share a Slack channel. And the amount of joy we get when we see, a patient response saying, "Hey, thank you so much. I was trying to get a vaccine for my elderly parent, and this process made it so much better." Or when we were working on diagnostics, which and people are saying, "Thanks for getting us the test in a timely way. It was so easy to get an appointment." That gives us motivation to keep going. And over the past year, we've seen our company flourish. We're hiring people as actively as we can, as rapidly as we can. And we know that the solution is the right one for the country. So, if there are opportunities out there for us to work with your communities, please reach out, because we know that we're doing the right thing. And we see every day in patient responses the impact that we're having in our communities. Really, for every 2,000 people who we vaccinate, we save one life. We've already vaccinated 80,000 people in LA alone. So that's, if you do the math, that's 40 lives that we've saved by going to market this quickly.
Well, doctor, thank you so much for the time. Really appreciate the work that you and the group are doing, and best of luck with everything going forward, and stay healthy, okay?
Thank you so much.